So why systematic review is the topic I'm going to talk on today, and it's relevant in medical literature because it is the highest level of evidence when you look at the pyramid of level of evidences. So wait. Understanding the importance of systematic evidence synthesis is very important because it starts in the post graduation where you start collecting data, and once that data is collected, it gets converted into a sort of a prospective collection of outcomes of a particular intervention. And once all these data are put in the public domain, you can collect them and try to draw some meaning. So most of the orthopedic training happens based on textbooks, but the difference between textbooks and journals is there's at least a 5-year gap. So the knowledge which is available in journals is at least 5 years old in the textbooks, if not 10. So the knowledge in textbooks can be 5 to 10 years old, and if you really want to be updated on the current knowledge, it is going to be through journals. And the best level of evidence that you get is from systematic reviews and of course meta-analysis. We'll talk about that later. A systematic review is a structured, transparent and replicable method for identifying, evaluating and synthesizing all relevant research on a specific topic or question. So each word here which I have put has a very key importance. So it has a method that is a central part of a systematic review, that it has a very robust method so that you get an outcome which tells you on an answer to a specific question. It plays a key role in guiding evidence-based decisions in healthcare, policy, education and other fields. So this is one of the bases on which you keep changing your treatment modalities, or you stick to whatever is existent as your treatment modality. It has certain key features of in how to do a systematic review and what are the components. So you might be thinking that it is just like writing an essay which was done in your earlier lives, but it is not so. In the last few decades, medical research methodologies have really structured, and systematic reviews have definitely. So it always has to have a specific research question, like you have a research question in your MS thesis. Similarly, it has to have a very clear question what you're looking for. And the difference is you're not going to evaluate your own patients. You're going to look at the answers given in the published literature already. So you will search through various databases. So as we go on in our journal club, we will understand the meaning of each of these words, questions and databases. Now the most popular database is probably PubMed, all of you know, for medical literature. But then there are various databases which are about unstructured publications also, which is called the grey literature. So now we have the strength of looking into grey literature also, which at times gives you a lot of knowledge about certain things. It has a predefined inclusion and exclusion criteria. Suddenly this thing which was not given too much seriousness has a huge seriousness in systematic reviews. Once we present the journal club today, you will understand about this. And the main part of the whole process is the critical appraisal. Most of us think that systematic reviews and meta-analysis is about a lot of softwares, lot of statistics, and some methodology in which publications are searched and then they are sorted out. Ultimately, the most important thing in a systematic review is the brain of the team which is trying to assess the literature which has been selected. So the critical appraisal of whatever has been selected through the inclusion criteria is the main base of what comes out ultimately, because after you look at an article, either you continue including it or you exclude it. Once you have included it, you look at the article and make a meaning out of it. So if I am a spine surgeon and I start looking at papers at tumor surgery, I will not get out sense. So as an editor, when I get a systematic review which is done wonderfully and it gets rejected, I get an email from the author that it is the best of the systematic reviews. And the mail goes that you are actually a spine surgeon and you've done a systematic review on oncology. So your understanding of oncology is just not there. So that is where the critical appraisal has to be from people who understand the field. It cannot be from anybody. It has a very transparent and a replicable methodology. That is what is detailed in various guidelines which are there on how to do a systematic review. And often it includes a Prisma flow diagram, which is morning, which seems to be one of the central part because it tells you about the methodology of how you're going to do the systematic review. So if you have to compare a traditional literature review, which is also at times called a narrative review, with a systematic review, there's a huge difference. So the objective is very, very focused in a systematic review because it has an aim. You're looking for an answer to a particular question. And in a narrative or a traditional review, often it's a very broad thing and you're trying to summarize, a few articles which you have just selected on your understanding. The methodology is predefined and transparent. Variables are not always stated in narrative reviews and traditional reviews. The search strategy is very, very comprehensive. And in traditional reviews, you just sit down, you pick out some articles on some thought process and summarize them. Bias control is very strong in systematic review. So the probability that you will get closer to a correct answer is high, and it is weak in traditional reviews. Reproducibility is high because there is a structured method to it. So if you repeat the same research question in a systematic review, the probability that the answers will come out will be same. However, in a traditional review, it will never happen. So it's a very low reproducibility. So I would request all of you to go back and Google this website. It is about Prospero. It is an international registry which registers systematic reviews, meaning in a systematic review also you're supposed to be having a protocol before you start your review, and it is now advisable to upload those protocols in such registries. Once you do that, you will actually get to know whether a similar systematic review is happening all over the world somewhere or not, because if the same question is being addressed by another team of researchers and they have already started 1 year back, so you are wasting time if you are addressing the same question. So you wait and don't do the systematic review and you look for their answer. However, if your topic is same and the systematic review has been published say 5 years back, 5 years is sort of a benchmark in which it is thought that you can address the same question once more in a systematic review, because science changes in 5 years. Unless it is a very niche area and nothing much would have changed. It's a free website. You can register your protocol, and once your protocol is registered, you get a number. So when you go down for publication and you share your Prospero registration number, it is automatically valued higher, because the editor knows that this is a review which is answering a question which is not being addressed at this point of time or in the last 5 years. A systematic review normally requires a year and a quarter to do if done properly. It cannot happen in a week or a month. And it normally needs around 5 people to gel together, and invariably the experience of those 5 people is of different level. It is never that 5 director professors or 5 PGs can do a systematic review. So that's a normal structure which happens in a systematic review. And why should we do it? In fact, the educational institutes should come out with one systematic review per thesis which is done every year. Because initially our review processes were the still which we write in our thesis, the review of literature is a narrative review. So as I have shown you the steps and the parts of a systematic review, if you do a systematic review in your thesis as a review literature, then your understanding and the message which comes out of what is there already in the literature. So why do you do a research? You try to fill up knowledge gaps. So only if you do a structured literature review, you would be able to understand that what is actually the knowledge gap, and your research question, did it address the knowledge gap or not. So it reduces the bias of what you have searched in the literature. It is more comprehensive. It is about evidence-based practice. It identifies the gaps very well. And then if some of us in the team who are more senior can understand the statistical process of converting a systematic review into a meta-analysis, it's a very good idea to do it, because it gives you even a next level of objective understanding of where the literature stands in relation to a particular question. As we go on in our journal club, we will again break down these factors and try to understand difference between meta-analysis and a systematic review, whether it is always possible to do a meta-analysis from a systematic review, or can we do a meta-analysis without a systematic review. There are very concepts to it. So to conclude, a systematic review are the gold standard in evidence synthesis. They offer transparency, rigor, and reliability. This is very key, the central part, and critical for advancing knowledge, shaping policy, and for us, all of us, for guiding practice. So when a new type of a patient comes and we don't have an answer, we normally, do a traditional type of a narrative review and try to match our solution to it. But if we have existing systematic reviews who are answering the question which the patient is raising to us, the outcomes would be even better.